This is Gina Roller, the Corporate Safety Director for Valley Senior Living, and today we are going to be talking about our safety program as well as emergency preparedness. Every year we like to share our safety statistics from the past year. So as you can see, we have 6 years compared in this chart, and we'll go down and cover a few of these. The first is WSI incidences not reported timely. So what we ask is that if you do injure yourself or tweak something and think you may have injured something, please fill out an incident report, even if it doesn't result in an actual injury, because we want to make sure that you're covered to get treated right away. And also, we are required by WSI to report any injury within 24 hours. And if that doesn't happen, we are given a penalty of $250. So as you can see, in 2018, we had 14 penalties of $250 each, just for not reporting within 24 hours. As we go down the row, you can see that we had 55 reportable injuries to WSI this year, 26 to OSHA. And then as you go down more, you can see our days away, meaning those were days away from your normal job duties. We had 24. We had 232 days restricted or transferred, which just means you were able to perform a job duty, but it wasn't your normal job duty. It was restricted duty or transferred to another position with lighter duty, most likely. And all of those statistics go into our DART rate, which is the 3.14, which, as you can see, it is better than the past few years, which is great. That DART rate is calculated per 100 staff members. So we had 3.14 staff members, 3.14 out of 100 staff members injured this year. And the last column is our transitional work cost for the last year. Here is a summary of our top 10 hazard vulnerability assessment scenarios. This information comes from a formula calculated based on the probability of an occurrence actually happening in our area, as well as the risk in terms of the occurrence being life-threatening, whether it affects the health and safety of our residents or staff, as well as our level of preparedness to deal with each occurrence. We will talk about each of these hazards individually. At the top of the list this year is severe winter weather. The National Weather Service issued 11 winter storm warnings this year, and we activated our storm policy 8 of those 11 times. What puts this at the top of the list is not only the frequency of the storms, but also the potential risk to human life and our inability, obviously, to prevent a storm. Thankfully, we are able to prepare at least somewhat, so therefore our risk is not quite as high as it would be otherwise. Number 2 is gastroenteritis illness outbreak. We only had 2 incidences, both isolated to neighborhoods, and thankfully no building-wide incidences in the past year. This is partially due to prompt recognition of symptoms and isolating residents to their room once those symptoms were recognized. So thank you very much for identifying ill residents quickly. That has helped significantly. Please remember that all staff need to be out of work for a 48-hour time frame if you do present symptoms of GI. And again, thank you so much for staying home when you're sick, another big contributing factor to decrease incidence this year. If possible, we will continue to try and dedicate staff to residents who are ill, rather than essentially cross-contaminating residents with staff who may have been infected and not know at that point. And please remember to contact your infection preventionist even after hours and on weekends, because it is very important to isolate these incidences as soon as possible. The third hazard on our list this year is falls. We had 1,089 recorded falls from July of 18 to June of 2019, 50 of which were falls with major injury. We did change our standard this past year so that foot pedals are now the standard. Leg rests can be used, but they must be care planned. But for sure, one or the other must be used while transporting residents down the hall, whatever it may be. Those need to be on and used with residents to help prevent their legs from catching, for example, while pushing a wheelchair down the hall. The Cardex must be utilized for residents and staff safety at all times. Please be following the care plan, as this also helps significantly for fall prevention. And a list of fall prevention intervention ideas were provided at ACE in your packet. Our fourth highest hazard risk this year is resident elopement. We had 4 occurrences of a resident elopement, 3 of which were out the same door at Woodside Village. Due to the Woodside Village addition, an additional exit was required at the end of the West Hall to serve as an emergency exit for the second floor, as well as for the courtyard. This door had a 30-second delayed egress, but is now permanently locked with a keypad access only and will automatically release in the event of a fire. Our policy has been revised in the past year to remove the Operation Amber announcement. It now reads, overhead and phone page, state 3 times, John Doe, please return to the blank neighborhood. A copy of this updated policy was also provided at ACE. An important communication tool was added to many of our policies as well, which includes phone paging, which I talked about in the previous slide with elopement. Please refer to these bright orange signs, which should be on all phones within the corporation. If you do not have one, please contact myself or your facility safety chair, and we will get you one. It reviews overhead paging from each facility as well as phone paging at each facility. This is important to be able to communicate to those in offices who cannot always hear overhead pages, so all pages will also be heard through all phones in the facility. Unfortunately, resident abuse remains in our top 10 at number 5. In the past year, there were 28 investigations of resident abuse or neglect, 20 of which were reported to the State Health Department. As a reminder, again, if abuse or neglect is validated through our investigation, the loss of licensure or certification could be the consequence. And failure to follow the care plan is oftentimes the root cause of an abuse or neglect investigation. For example, if someone is care planned to be transferred with assistive 2 and someone chooses to transfer that resident with assistive 1, that it could be considered neglect. Number 6 is Code Blue. We have 5 Code Blue incidences in the past year, 2 of which involved either a visitor or a contractor who was working in one of our facilities. Thankfully, both survived as a result of quick response from our nurses. One of the code events at Woodside Village did include a failure of one of the AEDs related to a recall on the model that we were unaware of. Although we had additional AEDs on site, it did make us question how we stay informed of recall events related to equipment we purchase. So as a result, a generic email was created for all warranties corporate-wide, so that important warranty information doesn't go to any one individual and could possibly be missed if that individual is no longer working with us. Number 7, and new to our top 10 this year, is IT system outages. We had 11 incidences, 6 of which caused a major system outage, such as our email being down or faxes not working, as just examples. So we learned quite a few lessons from these outages this past year, and they are listed below. They are increased education of users to spot potential scam emails, communication between Valley Senior Living and networking specialists needs to be more timely for outages or viruses. Individual users need to notify IT immediately with suspicious activity or suspicious emails. We've added additional layers of offline and offsite backup for our network. We needed to replace network components on a regular schedule to help prevent breakdowns. And we also need to increase password changes and complexity of those passwords in our electronic medical record programs. So in a nutshell, if you see anything suspicious or you think it may even have a hint of suspicious activity through your email, please contact George Overby in IT immediately, and if he is not available, networking specialists. Falling down the list this year to number 8 is influenza outbreak. We only had one outbreak, and it was isolated to one neighborhood. And again, this is largely in part to prompt recognition of symptoms and isolating residents to their rooms once symptoms are recognized, which again are not always textbook. So thank you again for identifying ill residents quickly. And please remember that there was a copy of the infection control policy and procedure for communicable and contagious diseases of employees in your ACE packet. Staff need to be out of work for 24 hours after a fever has resolved. And remember to use respiratory etiquette if cold symptoms are present, for example, sneezing into the crook of your elbow. And again, thank you for staying home when you're sick. And as with GI, if possible, staff will be dedicated to residents who are ill so as to try and prevent further outbreak. And remember to contact your infection preventionist in your community after hours and on weekends to report symptoms of staff or residents. Another new potential hazard that broke into our top 10 this year at number 9 was transportation incident. While we only had one incident and the resident was not injured, the potential for injury to a resident is high in the case of a transportation incident or accident. Therefore, it did make it into our top 10. We did learn some lessons from the incident that happened this year, and that was that if a resident with a lower extremity amputation is going to ride in the van, that a chest harness needs to be worn in order to keep them safely buckled in case of a quick braking. And therapy evaluations will be requested if there are ever any questions regarding how to transport residents. Last but not least, at number 10 is HVAC failure. We only had one activation. It was at Valley Elder Care Center, and our chiller system failed due to a power surge. We are currently in the process of building control systems that will provide more timely and detailed information on system failures to maintenance on call. So if this were to happen again in the future, maintenance would be immediately contacted or alerted via a text through these control systems that will help us react more quickly to such an incident.